Hey everyone, today we're diving into a topic that's incredibly complex, deeply personal, and affects every single one of us: healthcare ethics. And these aren't just abstract ideas. We're talking about real, life and death choices that get made every single day in hospitals all over the world.
Just stop and think about that for a second. In a crisis, you've got one ventilator left and two patients who desperately need it. How do you possibly choose? This isn't just a thought experiment, it's a reality that doctors and nurses have had to face. So, how do we even begin to think through something that heavy? Well, let's build a framework together.
Here's how we're going to break it all down. We're going to start wide and then zoom in. First, we'll get into that core conflict between caring for one person versus caring for everyone. Then, we'll unpack the four big ethical ideas that guide doctors. After that, we'll see how those ideas get tested by today's toughest problems, look at how technology is shaking everything up, and finally, check out a system that tries to make these hard choices fair.
Okay, so right at the heart of pretty much every single ethical debate in healthcare is this one fundamental question. Are we focusing on the single person right in front of us, or are we looking at the health of the entire community?
The absolute best way to get your head around this is to think of it like a camera's zoom lens, Clinical ethics, that's when the lens is zoomed all the way in. It's a tight close-up on one single patient. But public health ethics, that's when you zoom all the way out for that big panoramic shot of the entire community. Same picture, but two totally different perspectives.
Let's really dig into that. On one hand, you have the clinician. Their world revolves around one patient at a time. They're using your personal history, your exam results, to treat your illness. Their only goal is to do what's best for you. On the other hand, the public health doctor is looking at spreadsheets and population data. They're trying to manage the health of people who might not even be sick yet, to prevent disaster. Their goal is the greater good. And here's the kicker: neither one is wrong. But sometimes they are in a complete head-to-head conflict.
So, when a doctor is in that zoomed-in view, focusing on one patient, how do they make decisions? Well, they're not just guessing. They lean on a framework of four core principles. These have become the absolute bedrock of modern medical ethics.
First up, and this is a big one, is autonomy. This is all about you. It's the fundamental right to be the boss of your own body. It means you get to have all the information and make the final call about your own medical care, period. This is so powerful that it protects your right to say no to a treatment, even if your doctor is 100% sure it will save your life.
Next, we have beneficence. If autonomy is about the patient's power, beneficence is about the provider's mission. It's the duty to always try to do what's best for the patient. It's the engine that drives them to take positive steps, to heal, to help. It's that voice saying, "My job here is to do good for this person."
And then you've got the other side of that same coin, non-maleficence. You've definitely heard this one before. It's the famous oath, first do no harm. So this isn't about actively doing good, it's about making sure you avoid causing harm. It's that little voice of caution that asks, okay, but are the benefits of this treatment really, truly worth the pain and risk it might cause?
And the last pillar is justice. This is where we zoom back out just a little bit. This one's all about fairness. It says that people in similar situations should get a similar standard of care. It's about making sure that precious things like organs for transplant or ICU beds are handed out in a way that's fair and equitable for everybody. Okay, so we have this really nice, clear framework, right? Sounds great on paper. But what happens when these principles go to war with each other? What happens when respecting one person's autonomy could actually hurt other people? Or when trying to do good for everyone is literally impossible because you just don't have enough stuff? This is exactly where the theory crashes into reality.
All right, let's get real. We're going to take these four pillars and throw them right into the middle of some of the messiest, most difficult situations that doctors and hospitals are dealing with right now. This is where the rubber really meets the road.
First up, and this is probably the most common one, is resource allocation. The hard truth is that healthcare resources, whether it's hospital beds, medicine, or even a doctor's time, are limited. There's not an infinite supply.
So let's make this real. A new drug comes out that can cure a deadly disease, but the company can only make enough for, say, 10% of the people who need it. So who gets it? Do you give it to the youngest patients, so they have more years to live? Do you give it to the sickest, who are closest to death? What do? You can see it right there. The principle of justice, of fair distribution, is in a head-on collision with beneficence, the desire to do the most good. There's just no easy answer.
Next, let's talk about the duty of care. This is the idea that doctors and nurses have an obligation to provide a certain standard of care. But how far does that duty go? And whose care are we really prioritizing?
This one is just incredibly tough. Modern medicine is amazing at keeping people alive, but it can't always restore their quality of life. So picture a patient with a terminal illness. The duty of care, beneficence. It tells the doctor to keep treating them. But what about the family? The caregiver who is emotionally, physically, and financially exhausted, whose well-being matters more? It's a heartbreaking conflict.
Okay, our third dilemma is patient safety. You'd think this one would be straightforward, right? Of course we want to keep patients safe. But this duty can sometimes clash directly with that very first pillar we talked about, autonomy.
For instance, imagine a patient who is a high fall risk, but they keep trying to get out of bed against medical advice. Or think about someone who refuses a critical vaccine during a major public health crisis. Respecting their choice, their autonomy, could lead to them getting seriously hurt or even harming others. So where do you draw the line between their individual freedom and the hospital's duty to keep everyone safe? It's a constant tightrope walk.
Now, these problems of resources, duty, and safety have been around forever. But just when we think we're getting a handle on them, technology comes along and completely rewrites the rulebook, creating all sorts of new ethical puzzles.
I mean, just think about the explosion of new tools we have. Artificial intelligence that can spot diseases on a scan, telemedicine that lets you see a doctor from your living room, watches that track our heartbeats 24/7. It's a whole new world. And every single one of these amazing tools brings with it brand new ethical headaches.
This leads to some really tough new questions. If a diagnostic AI gets it wrong, who's to blame? The doctor who trusted it, the hospital that bought it, the programmer who wrote the code. And here's an even bigger one. What about justice? If all this fancy new tech is only available to people who can afford it, are we accidentally creating an even wider gap between the haves and the have-nots in healthcare? So with all of these thorny, complicated problems, how can a healthcare system possibly make decisions that are fair and that they can actually justify to the public? One of the big ideas trying to tackle this is called value-based care. And what's interesting is that it tries to bake the ethics right into its DNA. So here's the basic idea. Instead of just paying for more and more procedures, this model tries to juggle three big goals all at once. Step 1, make the quality of care as good as it can possibly be. Step 2, do that without bankrupting the entire system. And step 3, and this is the ethical core of it, make sure that the good stuff, the benefits, and the hard stuff, the costs, are shared fairly across all of society. It's really an attempt to make those tough resource decisions open and justifiable.
Wow, we've covered a lot of ground. We've gone from that 30,000-foot view of public versus personal health all the way down to the 4 pillars of ethics and right into the messy dilemmas of today. We've given you the mental toolkit that the pros use to try and solve these impossible problems. So I'll leave you with this question to think about. In a world where there will never be enough to meet every need, where do you draw the line?